Hi everyone, welcome back to the vlog. In the last episode, we talked about mentorship and the role that it plays in your growth as a new therapist. Today, I wanted to touch on some things that I wish I knew before starting in hand therapy. One thing that I heard in school from both professors and clinicians was not to go directly into hand therapy as a new graduate. It was often advice given that you should go and build your skills as a general OT first, and then if you want to specialize later on, that's something that you do a few years down the road. And while I do understand that perspective, it almost made it feel like hand therapy was something separate from occupational therapy itself. It gave me the impression that I shouldn't go into hand therapy as a new grad because it was something that I had to fully specialize in first. When in reality, it's an extension of our OT foundation, built on those same OT principles that we learned starting in school. While hand therapy itself does require more advanced clinical knowledge and experience, so much of what we learn in OT school is directly applicable to hand therapy. From the outside, hand therapy can seem like it focuses on more of the physical rehab side of things, but is actually very occupation-based at its core. And I try to use those principles every day with my patients, whether it's adapting grips or movement patterns to get back to a certain sport, making a rape bus out of therapy putty to get back into cooking in the kitchen. Functional activity and what is meaningful to that patient is the foundation of everything that we do. Another thing that I wish I understood earlier is that every patient is truly individual. In school and courses, when learning about diagnoses, they can seem very clear-cut and structured. But in real life, recovery is influenced by so many factors that go way beyond that diagnosis. Things like pain level, activity level, adherence to therapy, and even motivation can all play a role in how someone progresses. No two patients are ever the same, even if the diagnosis is identical. And because of that, you are constantly using your clinical reasoning, problem solving, and adjusting your approach. Something else that I wish I knew earlier is learning how to build exposure to this field early on while you are a student. Things like strengthening your general OT foundation, really understanding and trying to grasp upper extremity anatomy and physiology, and paying extra attention and maybe doing even a little extra work in the ortho-based coursework can go a long way. If you are able to, seek out shadowing opportunities or even gain a fieldwork experience in hand therapy can really help you understand how this clinical reasoning works in real time. Even while you are practicing, there is always something new to figure out, a new case that challenges you, or a new perspective that will shift how you treat a patient. And instead of that feeling overwhelming, I have learned that this is what makes hand therapy so special and so interesting. And lastly, early on, I wish I knew it was okay to have fun at work. Your personality matters in how you connect with patients and how you build trust and rapport with them. Making somebody feel comfortable, safe, and maybe even laugh a little as part of the rehab process is a part of the whole work too. So I would love to hear from you guys. What's something that you wished you knew before starting in this field? In the next episode, I'm going to continue talking about early career experiences in hand therapy. Thanks guys, and I'll catch you in the next one.